From anatomy to anesthesiology, from pathology to pharmacology, from microbiology to medicine, a one-man resource to the world of health sciences. Welcome to Dr. Paul's Medical Lectures. A practicing physician, Dr. Paul offers you essential insights on diseases afflicting millions of people around the world. For today's lecture, here is Dr. Paul.
This is Dr. Paul. Thank you very much. Today I want to talk a few minutes about hypothyroidism. Hypothyroidism basically insufficient thyroid hormone in action. It has an incidence of like 20% in adult women and is less common in men. So mostly it's a woman's disease. There are two types of hypothyroidism, primary and secondary. It's very easy to remember. Primary, the gland is not producing enough. Secondary is like stimulation. There is not enough stimulation from the TSH. You see, TSH comes from pituitary gland. So any problems that affect the pituitary gland or hypothalamus can cause secondary hypothalamus. There are other things we have to think about, and I'm going to discuss anyway. Now, hypothyroidism in utero can cause severe mental retardation and cretinism in the infant, like the fetus itself will be affected, and many times the fetus may not even survive if the hypothyroidism is very severe. So when we see this condition, it's very important to treat it in pregnant women, because very, very severe fatal things can happen. And also, so there is the gland and the stimulation. So the primary thing, that is the primary hypothyroidism, when the gland itself fails, whether it is due to radiation injury or chemotherapy injury or surgical injury. When that injury happens to the gland, we call it primary hypothyroidism. And anything that decreases the size of the thyroid gland can cause that. And you see, hypothyroidism doesn't necessarily be thyroid decrease in size. In fact, goiter, the swelling of the thyroid, can also be seen in hypothyroidism. That's a very, very important point to note. So thyroid enlargement resulting from lymphocytic infiltration. For example, we see that in Hashimoto's disease. In Hashimoto's disease, we see that lymphocytic infiltration of the thyroid gland resulting in the goiter. So even though Hashimoto's produces hypothyroidism, it is showing us a goiter condition. So you see, please do not confuse in that area. A goiter, the swelling of the gland, could be due to hypothyroidism or hyperthyroidism. It doesn't matter. Now, anything that affects the pituitary or hypothalamus will affect the TSH secretion, and the TSH stimulates the thyroid gland. So whenever there is not enough TSH secretion, that causes secondary hypothyroidism. So secondary hypothyroidism is not about the gland, it's more about the stimulation, the lack of stimulation of the TSH receptor. So even when there are these mutations in the TSH receptor, the TSH cannot act properly on those receptors, resulting in the resistance to TSH and thereby hypothyroidism. Now, thyroid hormone is very, very important. I cannot emphasize enough. I mean, every system in the body needs the thyroid hormone. The symptoms and signs of hypothyroidism are so vast. Why? Because this hormone affects everything. Now, T3 and T4 are similar, and I'm going to consider them as one hormone in the rest of this lecture. So the basic point is the development of the body, the functioning of the body, whether it is nervous system, skeletal system, reproductive system, cardiovascular system, pulmonology, whatever it is, it depends on that basic action of thyroid hormone. And even in fact other hormones like catecholamines, insulin, corticosteroids, they also depend on thyroid hormone. So when this affects in infants, we see congenital dwarfism or congenital myxedema. And when this happens, the IQ will be severely affected. I mean, in one study it showed that average IQ of these infants is like 7 points lower than the average IQ of normal children. So this has a profound effect on the mental development of the child. So very important, folks. And thyroid hormone.
Sorry.
Yeah.
Could you write on this order applies Solvadine with dressing twice a day
Yeah.
for home health, please? Is that all you want them to do?
Yeah.
Okay.
Thank you.
Thank you.
So the degree of changes, the hypothyroidism can be mild. You don't see any signs or symptoms, or you can see striking myxedema in severe hypothyroidism. We also see fluid retention in hypothyroidism, and that happens due to the interstitial accumulation of mucopolysaccharides. What happens is mucopolysaccharides, they accumulate. What is it? There can also be hyponatremia because this can affect sodium potassium ATPase, and the resorption of sodium can result from this action, resulting in hypothyroidism and hyponatremia. There is a condition called functional hypothyroidism we see in very severely ill patients. These patients, they will have hypothyroidism, but you don't have to treat it, because once that severe illness is treated, this hypothyroidism will disappear. So we call it functional hypothyroidism. Now a few words about goiter. Goiter is basically swelling of the thyroid gland. So remember that a swelling of the thyroid gland, it can happen by many causes. Thyroiditis, iodide deficiency can cause this, and genetic thyroid enzyme defects. There are drug goitrogens, and drug goitrogens like lithium, iodide, propylthiouracil, methanazole, and phenylbutazone, sulfonamides. There are amiodarone, interferons like interferon alpha, interferon beta, interferon interleukin 2. They can cause the goiter. Some foods like turnips and cassolas, they can also cause the goiter. Basically, the thyroid gland increases in size. So some cancers can cause goiter when the metastasis happens to the neck, and also sarcoidosis. Now, a condition called Decker-Wine's disease. Basically, you see subacute viral thyroiditis. So subacute viral thyroiditis, initially you see hyperthyroidism, but later it results in hypothyroidism. And the most common cause of hypothyroidism, folks, is Hashimoto's thyroiditis. That's very important to remember. So goiter is seen in these conditions, but goiter may not be seen when thyroid tissue is destroyed by radiation or surgery or chemotherapy. You don't see a goiter, but still the thyroid gland is destroyed and the patient has hypothyroidism. You see, chemotherapy can destroy those thyroid secreting cells, and there are medications called sunitinib. Sunitinib, for example, a medication used in gastrointestinal malignancies, can cause hypothyroidism in like 50% of patients. Also, more familiar example like amiodarone. You see, amiodarone has high iodine content, and it can cause clinically significant hypothyroidism in about 20% of patients who receive it. So amiodarone, please remember that. So in cardiac patients with amiodarone, they can have amiodarone-induced hypothyroidism. And if you stop amiodarone, their thyroid function comes back. So that's not a permanent condition you see here. Yes?
The gentleman with the burns, you just want the bandages changed tomorrow when the nurse goes in?
Yeah. The other condition is hepatitis C. Hepatitis C, patients develop antithyroid antibodies and attacking the thyroid gland, and patients develop hypothyroidism. So hepatitis C is a common cause of hypothyroidism, and as I said, when these patients are started on interferon, these interferons also can cause thyroid dysfunction because they act against thyroid hormone. Now, a few words about symptoms and signs. It's very easy to remember. As I said, thyroid hormone is important for everything in the body, and when you see these patients, just think one word: slow. Everything gets slow. I mean, when their metabolism becomes slow, these patients develop weight gain, brain becomes slow, depression, heart becomes slow, bradycardia, lungs become slow, shortness of breath, muscles become slow, muscle cramps, gastrointestinal system becomes slow, they develop constipation, and skin secretions become slow, so they become dry skin, the accumulation of fluid, carpal tunnel syndrome, and the body's basic mechanisms that produce heat become slow, they develop cold, and also they develop a brittle skin and thinning of hair, and sometimes edema in the peripheral areas, and a puffy face and puffy eyelids, skin pallor, and yellowing of the skin, and also the decreased reflexes, the deep tendon reflexes, they become slow in these patients. Patients often have that goiter. As I said, there are conditions that produce goiter, and all these things will affect. So remember these things, like everything becomes so slow. Using that, you can actually formulate your own signs and symptoms in these patients. And many times they will have weight gain because of decrease in metabolism, hoarseness, and thickening of the tongue, and auditory capacity decreases, the narrow reflexes become slow, they will have dysphagia, neck discomforts, and most of the women develop menorrhagia in this problem, but sometimes even scant menses or amenorrhea can happen. So folks, those are the very, very important things. You think about the causes and you think about the symptoms and signs. Very easy to remember if you remember few words. Everything becomes slow and everything becomes thick. The heart enlarges, we call it myxedema heart. The lungs gets enlarged, myxedema lungs. So you see the myxedema heart, and also the peripheral pericardial effusions can happen. And also there is myxedema madness when it affects the brain. So there is myxedema coma when these patients develop coma with a severe hypothyroidism. And when there is the myxedema lungs, when they develop pneumonia. So the basic point is this can happen to anything. And also secondary hypothyroidism, the TSH is secreted in high quantities. So as the pituitaries try to secrete more and more TSH, they themselves become enlarged. You see, thyroid gets enlarged, and also pituitary gets enlarged because of increased secretion of TSH by TSH producing cells in the pituitary. So all these things, folks, can be signs and symptoms. Once the pituitary gets high, and that can cause pituitary enlargement and cause headaches and blurry vision and all that stuff. So you see the connection here. So basic points, folks: primary hypothyroidism, secondary hypothyroidism. Primary when the gland itself fails, secondary when the stimulation fails. And there are signs and symptoms, there are diverse causes, and that's a long list, and you can actually sort it out as I explained in this lecture. Thank you very much, and tomorrow I'm going to discuss about the treatment and also laboratory diagnosis. Thank you very much.
Thanks for listening. For more medical videos, please visit us at www.drpaul.org and take time to browse through hundreds of health videos we regularly post on our site. If you are preparing for USMLE, PLAB, and other medical exams, make sure you visit our website to browse through our videos explaining the essential points you need to know before taking these examinations. For more information, visit us at www.drpaul.org. Thank you, and may God richly bless you.
Can you give them a pain? I mean, I don't know what's Roxycodone.
Oxycodone? They got Roxycodone, that's enough.
So, okay, well, no, the reason is so they didn't have to go to the pharmacy if they could have something for pain
from here?
Right, then they don't have to go pick anything up.
Tell them not to fill the other thing.
They won't,
then, okay?
right.
Because I am more afraid of poisoning.
Right.
Overdose.
Now,
Okay.
then they can just go straight home, and we did get it set up that Home Health will be going over there first thing tomorrow morning.
Oh, very good. So they can take Vicodin whenever they have pain, okay?
All right, thank you, sir.
Thank you.